Capitol Report is a production of Senate Media Services.
This week, the Senate GOP released their 2020 agenda. Majority Leader Paul Gazelka describes their priorities. Plus, the governor calls for wastewater system upgrades, and lawmakers work to reduce prescription drug costs and end teen vaping. Stay tuned for this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. This past week, the Senate Republican Caucus outlined their agenda for the coming 2020 legislative session.
Let's talk about taxes first. Taxes is an important area for us. Once we've funded all of our budget priorities and once we've filled up all of our reserves, you heard me say at the November forecast we should give the rest back. And if we look back to what we've done the last few years, we did provide some tax relief. I think it's time to fully exempt Social Security income. Let's be one of those states that doesn't tax our seniors when they've paid all the way through and then now they have to pay again. Department of Health and Human Services is much, much bigger. It's got many more problems. And one of the things that I hope we think about and find a way through is finding a way to somehow divide it up to provide a little more oversight because there's too many areas that have too many problems. Our vision for 2020 for education will address Minnesota's persistent achievement gap, beginning with our youngest children, using data to identify which early learning programs actually work the best, and then make those our top priorities for what we work on. We're also going to renew our commitment to real school choice for families and students stuck in failing schools. You have near daily reporting of gang violence spilling into the streets and public transit, and I find that very alarming. Being from outstate, I talked to a number of folks outstate that are concerned about coming to the Twin Cities. Is it safe? Well, we just need to assure them that we have a handle on this. So you can't have 100% renewable. But what we can focus on is clean energy that's renewable, that's reliable and affordable. And so that's things like the new technology related to nuclear. That's using more hydro. It's recognizing that coal coming from North Dakota is getting cleaner and cleaner. We're publicly saying we think we should have a bonding bill. I think it should be closer to the numbers that we had before. The last two were $825 million and $988 million. That's the last two. The closer it is to that number, the closer or the more support I have for it. But that is something that we are committed to doing. We are committed to working with the governor and the speaker to, at the end of session, actually pass a bonding bill. We want it to focus on wastewater infrastructure. We want it to focus on all of our higher ed buildings. We want it to focus on roads and bridges.
And Governor Walz proposed $300 million in bonding to upgrade or replace aging wastewater and drinking water systems around the state.
Today we want to talk about our proposal to meet the basic needs and the most basic needs of Minnesotans: clean, safe water. Every Minnesotan deserves access to clean water, yet that isn't the case in many communities across the state, especially out in greater Minnesota. Today, we all tour a storm tunnel in Minneapolis. Deep below the streets of downtown, the Central City Storm Tunnel was built more than a century ago to move storm water to the river, and it is bursting at the seams every time it rains.
Minnesota's water infrastructure is aging and becoming obsolete, putting communities and the public health at risk. Much of Minnesota's wastewater infrastructure was built with federal grants during the 1970s and 80s, while infrastructure in parts of Minnesota's oldest cities date back to the 1880s, as the governor talked about. These structures are reaching the end of their useful life and becoming less effective at collecting and treating water.
Senate Majority Leader Paul Gazelka now joins me in the studio to provide greater detail on the Senate GOP Vision 2020 agenda. Thanks for stopping by.
Good to be here again.
The state is in a good position right now with a full financial reserve account in place and also a projected budget surplus of over $1 billion. Should taxpayers expect tax proposals or tax relief proposals in the coming session, and who would benefit?
Yes, they should. The last 3 years, some of our policies, the Senate Republicans have, I think, worked, and so now we have a surplus. We fully funded our budget last year, education, HHS, et cetera. Everything was fully funded. Our reserves are right up at the top. They've never, we hit the ceiling. We have as much as we need there. What do you do with the rest? Some people want to spend it. I say we should give it back. So a couple of things that we're looking at. One is fully exempting Social Security income. That's something that Minnesota is one of a few states that does that. Maybe we could just get rid of that one. Another one is for farmers. It's called Section 179. It's when they purchase farm equipment. We want that to line up with the federal government and their tax law. That would save them some taxes as well. So those are a couple ideas. There's other things we're talking about, but those are two.
Let's turn to bonding, because this will be a bonding year, and that's also top of mind. Governor Walz has put together a package of proposals that would spend about $2 billion. You've indicated a willingness to go about half that far. What bonding projects will be priorities? What kinds of projects will be priorities for your caucus in the coming session?
Yeah, so first of all, it's important that people know that I'm saying we should have a bonding bill. There's many of negotiations where one side says we're not going to do any bonding bill. And so we're publicly saying we think it's good for Minnesota to do a bonding bill. Our forecast says that without having to pay any more interest above what we normally predicted, it would be $755 million. So that's kind of the bottom number. Our last two bonding bills have both been under $1 billion, but right around that number. And so that's the first thing, is what is the final number going to be? But we're openly talking about, let's all figure out how to do a bonding bill. And then what we want to focus on is wastewater infrastructure will be a big one. Higher education, their buildings need upkeep. Things, roads and bridges, those are the key things that we want to do. Focus on the main things that everybody benefits from. Then the size of the bonding bill isn't as important as what we focus on.
So focusing on wastewater, higher education, roads and bridges.
Yeah, those would be
those three areas.
Yeah.
Okay, your caucus has been very active in looking for ways to lower the cost of health care. And that issue is something voters care deeply about. What are some goals in the coming session to tackle both access and cost of health care?
So first of all, cost. We have been making great progress in the last 3 years. We did something called reinsurance, which stabilized the market, brought more competition in, and right now Minnesota's rates are cheaper than anywhere else in the country. So it's really good news, but that doesn't mean your work is done. You should keep working towards that. So one of the things that we're going to work on is drug reimportation. Why can't you go to your pharmacy and get prescription drug costs like what you do in Canada? So that's the big one that we're rolling out right now. There'll be other things as well, but that's the one that comes top of mind.
Okay. There will be a supplemental budget also this session. And are there any areas specifically where state spending should increase, whether it be education or veterans or farmers or childcare? Where should maybe some of these excess dollars go? Where is there still need?
First of all, we're not saying that there will be a supplemental budget. We'll have to have a conversation about that. Most of that $1 billion plus surplus is what we call one-time money. It's there now, but it won't be there 4 years from now. And so we'll have to look at that very prudently. One of the one-time dollars that I'm open to is if we haven't fully taken care of safe schools, making sure their buildings are safe, that would be one of the things that for one-time money I might be open to, but we're not automatically saying just because we have a surplus means we want to spend more money. We're talking about giving it back to the taxpayer.
Now, I did read in the press release, though, that tackling the disparity gap in Minnesota would be something that you would look at. Do you have thoughts on that?
Yeah, last year we brought up the fact that we thought we should do opportunity scholarships, provide more ways for the disadvantaged to find more directions they can go to get a good education. Our disparity in Minnesota, racial disparity for education, is lower than anywhere else in the country. So the disparity is great in Minnesota between white and, say, black, but you take that same black population in other urban areas around the country and we're not doing well against them either. And so I say it's the definition of insanity. If you keep doing the same thing, you're going to keep getting the same results. We have to be willing to try things like the Opportunity Scholarship. There's a program called ACE in Texas where they pay teachers more to be in front of students in very difficult districts. So we have to explore things that are different than what we've been doing, and I'll continue to advocate for that.
There has been a spike in violent crime in Minneapolis and St. Paul of late. Addressing the uptick in violence is a priority for your caucus. What types of proposals would be included in lowering the incidence of violent crime, especially in Minneapolis-St. Paul?
So we know it's a complex problem, but it is rising, and so we just say it's unacceptable. One of the things that we're going to do, in fact, we're doing a hearing on this up in Hibbing within the next week on public safety issues, and one of them is being tougher on felons that have a gun. They're not supposed to have a gun. If they've got a gun and they're a felon, the odds of them committing a crime are going to go way up. And so we want to be, that's an area that we want to explore to actually be much tougher in that area on sentencing.
Okay, anything else at this point on that topic?
No, not at this point.
Not at this point. Okay. Recently, both the Energy Chair, David Osmek, was on the program, and the bill's author, Senator David Senjum, talking about clean energy first. What are the benefits for the state by setting up a preference for clean energy over the traditional ways that we have powered this state?
So there's been a lot of conversation about 100% renewable by 2050 or whatever, and I've always said that's not the way we should be going. Last year we had the polar vortex in February. Our 30% renewable energy could only produce 5% of the energy we needed. So if you just have renewable, that's a problem. And so we're saying let's focus on clean energy that's affordable and reliable. So it includes renewable energy, but it also includes the new technology, nuclear. It includes clean coal out from North Dakota. They're being able to capture all of the CO2. I mean, we have different technology today. We should be using the resources that come from water. I mean, we should look everywhere. If the goal is about reducing the carbon footprint, it doesn't have to just be renewable. So we're going to emphasize all of the above. Let's use technology today and move in that direction.
And finally, before we go, there have been lots of problems with the Department of Human Services, lots of headlines, overpayments to tribes and counties. The legislative auditor issued a report recently pointing to, quote, troubling dysfunction. Your caucus has said that you're looking at oversight and accountability measures. What does that entail?
Well, first of all, it's an area I hope that the governor leans in with us. We did work together to fix MNLARS, our license and registration services. That was an area that we had talked about for probably 6 years. This governor agreed to have an independent third party look at it, and we ended up going the direction that we talked about. I think DHS, Department of Health and Human Services, is even worse. It's many problems, and one of the things that we are exploring is how do we divide it up so that there's better oversight of some of these areas. I mean, there's so many areas for decades that have been a problem. So we're asking the governor to lean in with us. We will put forward proposals for this session, and I'm hoping we can get them done.
Senate Majority Leader Paul Gazelka, thank you.
It's good to be here again.
One of the priorities of the Senate Republican Caucus is the reduction of prescription drug costs. And last summer, the Trump administration announced a two-part plan that could lower the cost of prescription drugs. Senator Michelle Benson, chair of the Health and Human Services Committee, held listening sessions around the state last fall and recently joined me in the studio. I began by asking her what she learned from these town hall meetings.
We've seen as policymakers and as somebody who watches the insurance industry that prescription drugs become a larger and larger part of the cost of health care. Some of that's good. If a prescription drug is keeping you out of the hospital, it's actually lowering the overall cost of care. But because there are high deductibles and co-pays, a lot of people are feeling the direct impact of the high cost of their prescription medications. And we're hearing that there are new seizure medications that came out in 2018 that are revolutionizing the way seizures are treated, but they're expensive. They're new. British company rolled them out, and it's painful to hear people talk about how they can't afford this latest medication and how the other ones aren't necessarily working for them. And so it's good motivation for us to keep pushing on this issue.
The first prong of the Trump administration's approach would allow states to import certain drugs from outside the U.S., places like Canada. Many prescription drugs are significantly cheaper in Canada. So what would Minnesota need to do to gain access to these lower Canadian prices?
Well, we would have to allow, it's the mechanism of a wholesaler in Minnesota having a partnership with a wholesaler in Canada, because we want to make sure we have full traceability and trackability on these drugs. It's important for safety that they not be adulterated drugs that came in from another country. So we want to make sure we know where they came from the manufacturing process, all the way to reimportation. And so that's going to require some legislation, and it will require us to have our Board of Pharmacy do some inspections at those wholesalers and verify these relationships. And so we're working on language now, and we're working with all the stakeholders who would be impacted by this. And there's some openness to it, but as with everything, there's concern about how it's actually going to work when it's implemented. If you remember, the Pawlenty administration started doing this.
I was going to mention that. Yes.
Yes, and so we have some of that legacy here in Minnesota, but with the 2013 Safe and Secure Drug Act, we have this added wrinkle of full traceability, which I think Minnesotans want. They want to know their drugs are safe in the supply chain.
Now, which drugs qualify for this? Because it's not all, is it generic, is it name brand? Does it affect insulin?
Well, and it would have to produce significant savings. It couldn't be infusion drugs. And the question about insulin is it a biologic or is it a drug? So we have conflicting parts of code right now. And when we asked our colleagues in the federal government, which one is it, because we see it in two places, they said, well, we'll get back to you. So March, we're supposed to have an answer, because it's not just Minnesota that it's impacting, it's the industry and how it's defined, how insulin is defined. But there would be, it would be limited drugs, because Canada doesn't have the full formulary that Minnesota has. Probably not generics, because we already have cheaper generics than they have in Canada. Nothing that would be given in a hospital or in an infusion center. And so it's not a panacea. We're not trying to sell it as that. What we're trying to do is get the pharmaceutical companies to stop treating Canadians better than Minnesotans. We want to be treated fairly. So if you can get an Advair disc in Canada for $6 and it's $60 here, that's not fair. So let's figure out how we get pharmaceutical companies to change that behavior. And if this is what it takes, this is what we'll do.
The other part of the Trump administration plan, the second pathway, would allow pharmaceutical companies to verify that their foreign-produced drugs achieve the same safety standards and protocols as American counterparts, and then offer those foreign drugs for sale in the U.S. at the lower price.
Right.
What is the incentive for the pharmaceutical companies to want to do this?
Well, first of all, they need to treat Americans fairly. And I think having these intense conversations about the cost of prescription drugs is resonating with some of the pharmaceutical companies. But they're kind of stuck. Let me tell you why. There's something called a national drug code, and all of the rebates that are required at the federal level peg off that national drug code. And so, for example, you'll have drugs that have 4 different categories of federal rebates. They put a price on the national drug code, and in the private market, that price is what you see, even if you're not getting the federal rebates. But if they put a different national drug code, those rebates at the federal level don't apply, so they can actually just lower the price and make it more transparent for consumers. And so there's some interest. We have started talking with pharmacies to see how this would work for them, distributors to see how it would work for them, and we want to sit down and partner with some manufacturers who are going to have the biggest impact. And it's not just their foreign produced drugs. There are drugs that are produced here in the United States that are labeled for foreign sale in Israel and Ireland. They could just give them a different national drug code, avoid this whole rebate mess, and make it available at point of sale at pharmacies.
Now, pharmaceutical companies do have an interest, though, in a certain amount of return on their investment for research and development. So how is there a balance? How do you balance that?
And we want them to be sustainable. That's how you come up with new seizure medications. That's how you come up with new medication or drugs that treat specific genetic disorders. And so we don't want to have a chilling effect, which is what some of the foreign countries' behaviors actually have a chilling effect on R&D in their country. And so by letting them have this second national drug code and not be subject to the rebates, there are some rebates where the state of Minnesota actually gets more in rebates than we spend on the drug. And so the manufacturers, this gives them a back door. It gives them a different way to get the necessary pharmaceuticals to the people who need it at a price without the rebate game.
Do you expect there to be bipartisan support for this?
I think because we're moving into an election year, my hope for bipartisanship is slipping a little bit, but I hope that I can put forward a reasonable, well thought out bill language that somebody could look at and say, okay, we can live with this. And if it doesn't pass this year, we can bring it back when it's less political and when it's not an election year.
Senator Michelle Benson, always a pleasure.
I'm glad to be here. Thanks for having me.
Not long ago, physician and Senator Matt Klein joined me to talk about prescription drug prices and the rise in teen vaping. I began by asking him if reimportation of prescription drugs from places like Canada would be good for Minnesota.
I think we should fix what's wrong with drug pricing in America and in Minnesota and not try to go around the system by getting drugs from Canada. I have worked very closely with Republican Scott Jensen, the other physician in the legislature, on some sort of drug pricing oversight commission, similar to the Public Utilities Commission, where we could investigate if the cost of a certain medication, like an epinephrine pen or insulin, for example, went up by 400% in a year. This commission would be charged with looking into that. Is that cost justified? Is it comparable to market rates? And if it's not, if it's gouging or extortion, then they would have some power to punish or impose penalties on that. I think that's the only way we're going to get to the bottom of this type of balance between the for-profit drug manufacturing industry and the needs of humans in Minnesota to receive necessary medications.
This week, by happenstance, an ad came through one of my social media feeds from pharma, making the point that America leads the world in medical innovation and producing half of all new medicines. And medical innovation isn't cheap. Some of these drugs cost billions of dollars to develop. And so I would assume that they would argue that there's some recouping of their cost that needs to be done. So how do you balance that innovation with prices that people can afford?
That's the fundamental question. And as a physician, I am incredibly grateful to the pharmaceutical industry because they create the miracle drugs that allow me to do my work and save Minnesotans. And without them, without their sort of drive for innovation and profit, candidly, we would not have those innovations, and those are great drugs. The problem is, and they quite appropriately are driven by profit to manufacture and generate those things, and then once available to drive up the price as high as the market will tolerate. But once those drugs are available, as a society, we have a moral obligation to make sure those drugs are available to everybody, regardless of income or means. So how do you balance those two imperatives, Shannon? How do you balance a for-profit industry with our social obligation to our own citizens? And again, I think it's by creating some sort of oversight board that reconciles those two imperatives and tries to find a middle ground.
Do you believe that the new legislation that will come online soon that will shed a light on the PDMs, the pharmacy benefit managers, do you think that will make an impact in the future?
I do. So that's one step in the chain. It's not a complete solution, but it at least shows that the legislature in a bipartisan way is serious about people who are sort of driving up prices within the drug delivery system. PBMs are one sort of secretive institution that not a lot of people know about, but they are a middleman between your doctor and your pharmacy, and they do contribute significantly to costs. So we've made some steps to sort of shine some light on their practices.
What do you tell patients that are struggling to afford the medications that they need?
You know, sometimes there are some very hard conversations, and I can't tell you that I always have an answer for them. We do the best we can with charitable care and with in my work at the hospital, discharging people with supplies. But there are some times where you have very real and very honest and very unfortunate conversations with patients who simply can't afford the necessary medications, and we don't have a good solution as a society for getting them those medications. And of course, you saw it with Alec Smith, who couldn't afford his insulin and died as a result. So there are not clear solutions right now, and that's what we're working on here at the legislature.
I'd like to turn now to vaping. Last week we had Senator Carla Nelson on the program. She is a proponent of measures that would raise the age to purchase tobacco to age 21 and also get rid of those kid-friendly vape flavors. Her legislation has bipartisan support. So I'm wondering if you agree with that approach in terms of getting a handle, especially on the teen vaping that is really on the rise.
So Shannon, this is very personal to me. I have 5 children. They're all teenagers, age 15 to 20, and they have described to me this explosion in vaping at their high school. And it's a real problem. The number of students who vape are escalating rapidly. At the hospital, we see people come in with severe lung injury and sometimes death. And if they avoid that outcome, then these teens are hooked for life for the next 60 or 80 years of their life on nicotine products. Raising the tobacco age to 21 is a good proposition. I have co-authored that bill with Senator Nelson, and I will continue to support it. Eliminating flavors is clearly an essential step here. Flavors are how students and teens are getting hooked on nicotine vaping, and if we eliminate the flavors, we will make some significant progress in that regard. Shannon, lastly, I've authored a bill which would create a tax on pods. Pods are these little cassettes that go into the vaping device and allow people to vape.
And they're available at gas stations and tobacco supply stores all over the state.
They are, yeah. And we proposed a $2 per pod tax. We know that the youth market in particular is extremely sensitive to economic incentives, and raising the price, by any amount causes a correlation decrease in tobacco use among youth. So I am going to continue to push for a $2 per pod tax on vaping products, and I think that might be the most effective solution to moving us towards decreased youth vaping road.
Making it more expensive, getting rid of those kid-friendly flavors, and then also raising the age limit certainly would limit the access for those kids. So as a doctor, a parent, a lawmaker, you've said you're very concerned. Beyond those measures, like what do you say to kids? What do you say to parents who maybe have a kid who's been vaping? What's that conversation?
It's really tough. So there's the pod market that is Juul and other manufacturers that people can order online and so forth. And then there's this whole sort of open device market where you can go to a vaping store and just buy a bucket of liquid and then insert it in your own device. And that is where we're getting into real serious health problems. That stuff is unregulated and unmonitored. Sometimes it contains, other recreational drugs, and it's clear that some of the byproducts of what's in those liquids is creating some of these cases of severe lung injury and in some cases death. So those products in particular are fearful, and I try to counsel my kids to stay away from them.
Senator Matt Klein, thank you so much.
Always a pleasure, Shannon. Thank you.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.